Hello everyone, I'm Dr. Anuj and welcome to Mastering Clinicals. This is the very first module that we are shooting and I'm so excited to see you all over here. This particular module, I'll be going over some of the most basic things that we as doctors sometimes ignore. The first part of this module is going to be consisting on the etiquettes that a doctor should have and the doctor-patient relationship. Oftentimes, when we are working in government settings, we are seeing so many patients a day. Hello everyone, I'm Dr. Anuj and welcome to Mastering Clinicals. This is the very first module that we are shooting and I'm so excited to see you all over here. This particular module, I'll be going over some of the most basic things that we as doctors sometimes ignore. The first part of this module is going to be consisting on the etiquettes that a doctor should have and the doctor-patient relationship. Oftentimes, when we are working in government settings, we are seeing so many patients a day. When you are in internship, you will sit down and take out an OPD of 150 or 200 if you're in a good government medical college. And at that point, in your mind, you don't have that doctor-patient relationship. You just want to get over with the OPD, see as many patients as possible and as quickly as possible. But when you step out into the real world, actually it matters quite a lot on how you talk with the patient, how you greet them, the way that you address their problems with them. And that's where this exact module will help you quite a lot. So in this module, let's talk about the etiquette. First of all, please know that whenever the patient is coming to you, they are having some sort of an issue. They are having some sort of problem. They might be in some sort of pain or a chronic condition that might be affecting them very seriously. It might mean very less to you, but it might mean very much to them. For example, if a daily wage laborer comes to you with a rash on his face, it might not mean that much to him. But if the same thing an actor comes to you with a rash on his face, that might mean quite a lot to him. So at any point, whenever a patient is approaching to you, you must be empathetic towards the patient. You must try to understand what the patient is exactly going through and try to figure out how it is impacting their life. Only and only then can you start your examination. Always be respectful to the patients. Now, the patients that you might see on a day-to-day basis, they might be very big personalities, or they might be illiterate people, they might be daily wage laborers, they might be people who are as teachers, who are as doctors. So in any case, it does not matter what the occupation of the person is, you have to respect them as a human being. Respect is always a give and take thing, and if you respect your patient will respect you. Next, whenever the patient comes to you, talk to them very politely, stay humble, stay grounded, and let them speak freely. They will talk you about their problems, they will tell you everything about their life. When you are actually practicing, you might feel that sometimes the patients may speak irrelevant things to you. They might tell you things which are absolutely not at all important for the disease or a clinical condition that you are chasing towards. But let them speak it out, because for them, you are the doctor and they are seeing you for the very first time. But of course, if they try to go on and elaborate a lot about their life, it is good for you to interrupt them in between and try to get them back to the topic in hand. So these are some of the few things that you should absolutely keep in mind whenever you are seeing a patient. These were the few things of the doctor-patient relationship. Next, I also want to tell you a very important thing in our medical curriculum, and that is consent. So consent means somebody is agreeing for their general physical examination, the systemic examination, or some invasive examination that you're supposed to be doing. The legal age for giving consent for general physical examination is 12 years of age. So after 12 years of age in India, a child can give you the permission for conducting a general physical examination. What does this include? This includes the temperature, pulse rate, BP, the PICL, that is pylorictus, cyanosis, clubbing, lymphadenopathy, and edema. So these are the various things. Next, for any invasive or any severe big examination, the age of consent is 18 years. And if a person is under 18 years, they should be accompanied by a guardian or a parent. The thing is, you have to always tell the patient what you are supposed to be doing with them. The consent has to be informed. And informed, you have to tell them what are the procedures you're going to be doing, what is the significance of their procedures, and how the procedure might impact them. Without explaining all of this to the patient, don't go with the examination. Whenever you are in a government setting, at least take 1 or 2 lines, say to the patient that I have to do this particular examination on you. This will help you this way. Or do I have the consent for examining you? In your local or regional language, you can ask them the permission and they will give you the permission. So that is very essential. Next, whenever you are seeing any female patients, even in the medicine OPD, you have female OPD, male OPD, in surgery, male and female OPD. Whenever you are seeing a female patient, it does not matter the age. Always remember that you have to have a female attendee present with you if you are a male doctor. And if you're a female doctor, it's okay. Even if you don't have a female attending, that's okay. But all the male doctors who are watching this, please make sure that you have a female attendee by your side whenever examining a female patient, even for the general examination, that is. As we go on, the medical legal cases are always on the rise, so you have to protect yourself at any cost. So taking care of just these few basic things will really help out quite a lot. Now, these were the etiquette parts. Now, I want to take you through exactly before the patient even approaches you and before you even start the examination, how do you approach this particular fascinating thing of using your own skills, using your eyes, and using the way that the patient is speaking, the way the patient is talking, to come to a provisional diagnosis inside your mind before the patient has even told you a symptom. The clinical examination actually starts the very moment the patient enters into your OPD. The way they walk, that will give you an idea about their gait. The way their dressing senses will give you an idea about their socioeconomic history, as well as what is something they're suffering from. There might be blood on their t-shirt, there might be vomit on their t-shirt. That will give you an idea of what is actually happening. When you see the gait, you will see whether it's the lurching gait, whether it's the waddling gait, is the circumducting gait, whether it's the high stepping gait. All of these are different types of gait that we will be studying in this module. So as soon as the patient walks in, you will have an idea of what the patient is suffering from. When they sit down and they start talking to you, you will have the problems associated with speech. So you might be able to diagnose a Broca's aphasia, a Wernicke's aphasia, a repetition aphasia, or something else entirely. You might also get the idea about the psychiatric issue of the patient if the patient is having something while they are speaking to you. So like I said, you have to have a good clinical eye, and you might be able to see things which normally other people cannot see. When the patient is talking to you, and if the patient has some particular odor of their breath, you might be able to diagnose the condition right then and there. You might be able to smell the fruity odor, or you might be able to smell a nasty smell, which is usually associated with the abscesses within the lungs. So all of these are very, very, very good clinical things that as a doctor, when you see and when you actually practice, you will feel really good within yourself. So just saying that have a good clinical eye, read good textbooks that teach you how and exactly why this is important. And of course, by taking this modules, you have already done a good step, and we will explore all of these details as we go on in the modules. Now, I also want to talk a bit about how a doctor should look like. So we are living in the modern world. There is no specific guidelines on how you should look like, but just for the sake of it, you should wear a good formal attire. You should have a smile on your face. You should have your good combed hairs, and you should have all the equipment that we use for daily clinical examination. You should by default be having a good watch. This watch should have a seconds dial within it, because you're going to be doing a lot of measuring with respect to time, a lot of rates. We have to calculate the respiratory rate, the pulse rate, the deficit, and everything in between. So good watch is a must. Next, you should have a good respectable approach towards the patient. And most importantly, the most important is you should have good clinical knowledge, because as a doctor, you do not know when the emergency will call upon you. Once I was in a flight and there was this person who was having a Guillain-Barré syndrome. So she suddenly developed this acute condition of having all the muscles suddenly going limp and proximal muscle weakness. At that time, I was just a third year MBBS student or a final year MBBS student. But at that time, I had to use my clinical knowledge to help the patient on the airplane. So such a thing can happen with anybody. And at that point, what is most essential for you to realize is having a good clinical skills, good clinical knowledge is what's going to help the patient quite a lot. It does not matter how much marks you score in your university examinations or your NEET PG, because in the end, you're going to become a doctor. You might already be a doctor, and clinical skills are absolutely essential. So that was basically all I really wanted to speak to you in the first module. Now, in the next one, we'll be talking about the basic of history taking. And in the basics, we'll be first going towards the demographic data. Are you ready? Let's go.